My name is Faisal Aziz and I am a PhD student at the Medical University of Graz, Austria. The study title is Association of Serum Glucose Levels with Disease-Free Survival in Soft Tissue Sarcoma Patients. I have no disclosure statement to make. The background of study: accumulating evidence implicates diabetes in adverse cancer outcomes. In addition, hyperglycemia has been shown to be an independent predictor for outcome in various cancers. However, the independent effect of hyperglycemia on cancer outcomes is not well known. Therefore, we conducted this study with the objective of investigating the association of serum glucose levels with overall survival and disease-free survival in soft tissue sarcoma patients after curative resection. Study methods: it was a retrospective study design in which we recruited 430 patients with localized soft tissue sarcoma and without established type 1 and type 2 diabetes. The data were obtained from a public hospital of Medical University of Graz, Austria. Main study variables included demographic characteristics such as age and gender, and tumor characteristics that included tumor size, tumor depth, and adjuvant therapies. And our main outcomes were overall survival and disease-free survival. The overall survival was defined as date of surgery until the date of death, while disease-free survival was defined as date of surgery to the date of tumor recurrence and distant metastasis. Post-surgery glycemia was calculated by taking the average of all post-surgery glucose values. Statistical analysis: Kaplan-Meier plots were presented for survival outcomes, and unadjusted and adjusted Cox proportional regression analysis was performed to study the effect of post-surgery glycemia on survival outcomes. In results, the figure 1 shows the overall survival of patients. The total follow-up time after the surgery was 17.5 years, and the median survival was 13.4 years, and 5-year survival was 74% and 10-year survival was 60% respectively. Figure 2 shows the disease-free survival of patients after curative resection, stratified as overall disease-free survival presented in green line, and tumor recurrence-free survival presented in red line, and metastasis-free survival presented in black line. Figure 4 shows the adjusted Cox proportional regression analysis of disease-free survival. Figure 3 shows the adjusted Cox proportional regression analysis of overall survival with glucose and other variables. As you can see that increase in glucose actually increased the hazard of worse overall survival. However, this association was not significant. Whereas the figure 4 shows the adjusted regression analysis of disease-free survival with post-surgery glucose. And as you can see that increase in glucose by 10 milligram per deciliter increased the hazard of disease recurrence by 10%, and it was statistically significant. In addition to that analysis, we also compared survival outcomes between diabetic versus non-diabetic patients. As you can see that diabetes was significantly associated with adverse overall survival, which was statistically significant. And figure 6 shows the adjusted Cox proportional analysis of disease-free survival in diabetic versus non-diabetic patients. Though the diabetics were more likely to have worse disease-free survival, however, this association was not significant. In conclusion, mean post-surgery glucose is significantly associated with worse disease-free survival in soft tissue sarcoma patients, and these findings suggest that serum glucose levels as a potential future biomarker for adverse outcomes in soft tissue sarcoma. That's the end of my presentation. Thank you so much.